Well, hello and welcome to all of our viewers around the world. I'm Fiona Langsharp, IBCLC Director of Communications and MC here at Gold. Welcome to all of you joining us here today. We are talking about our Gold Neonatal Online Conference 2023. We're in our 7th year, if you can believe that, which is absolutely fabulous. Just spending the time with all of our friends around the world and celebrating what's new and updates in the neonatal units. And back here with us, we have Jennifer Barnes. It's so good to have
Hi.
you here today. Thank you for joining us.
Oh, thank you for having me. I'm excited for the upcoming conference.
Yeah, we are too. And we know having you here doing a great amount of knowledge translation because you are a neonatal intensive care clinical pharmacy specialist, talking about all things pharmacology, of course. Sometimes that's really hard to translate for us, Jennifer. So thank you for being that great translator and that teacher. I don't even know if you ever knew that you had that gift, but it works just great for the rest of us in the world. So thank you for bringing all your skills to us once again.
Oh, well, I appreciate you having me back. This is my third year in a row, so I'm looking forward to it. It's a very different topic than my years past. So,
Oh, that's good. That's good. Yeah, let's talk just quickly about the topic. Don't miss your shot to learn about immunizations in the NICU. I love how you always put a little twist on your presentation titles. But yeah, we're going to be talking about all different types of immunizations, which is great, really, to stay up to date because, we need to inform our clients, our families about what's available and, of course, what's on the schedule for them. Were there things that you discovered when you were looking at the immunizations, new things, old things? What happened for you when you were putting this presentation together?
yeah, so I think I've been very passionate about vaccinating in our neonates for quite some time. I think, it may not be relevant for your older infants that aren't necessarily in the NICU for very long, but I think as many of us know that there are infants that really do spend, months in that NICU, and that
Right.
really keeping them up on their schedule is great. I think one of the interesting things that kind of found out while really getting in to the weeds about is I knew that vaccinations had really improved child mortality in the past, 150 years. But I think really sometimes seeing some of the graphs and really looking at the historical perspective was very
Mhm.
interesting for me personally. I don't necessarily want to say my age, but I think childhood vaccines have been very much a part of my childhood as well as my own children. So I think
Right.
just really thinking and looking back to how far we really have come.
Yeah, the options that are available today, of course, have changed significantly. We were just talking offline that our childhood vaccinations differ greatly to, our children today, and so yeah, it's going to be great actually to look at some of that research. I think that families that are making decisions, about vaccinations or what they are, maybe they plan to get them all along, but just again having the information, being informed, and yes, when they're in the NICU, like there's so much going on, but I think it's still so important that everything that's happening, you should know about, everything that's happening to your child, and keeping them on schedule, if it's safe, of course, is really, really important, because then it just doesn't get missed. It's like they're not excluded from anything unless it's medically necessary. So that's really fabulous. So, Jennifer, tell me what else has been happening in your life recently. I know you said you've been here, but always, I know you've been so busy recently. Give us some updates on your work life. What's been happening?
Oh yes, well I'm still the clinical pharmacist for the NICU at Atrium Health Levine Children's Hospital. So I've been there about 6 years now. And I think one of the interesting things, and I don't know if this is mostly for the U.S., we're really acquiring and merging different hospitals. So that's been big up on issues. But I think just even like what's new is I've children, and so just always that balancing of work and extracurriculars as well as
Yeah.
what they have going on as well. So I'm sure many people out there kind of feel that balance that really happens between work and
Yeah,
life.
the
So
work life family balance, right? That we're all trying to find. Well, I mean, it's great that you're keeping busy. I know it's been a particularly busy time for you just to get with all these different merges and things happening as well. Did you see yourself in this position 10 years ago? Like what did you anticipate was going to be happening here, Jennifer?
I've always loved the NICU. I will say when I first started, pharmacists are interesting in the sense that you don't always have to specialize, and so I always knew that pediatrics was something I wanted to do. But I didn't necessarily always know the NICU. But I think as time went on, I was like, oh yeah, I like the NICU. But you always think of like traditionally when you start a position, you're like, this is the unit, and you don't necessarily think about how those hospitals spread. Does that make sense? And so, yes, you can come up with a
Yeah.
policy for your babies that you're taking care of on a daily basis, but how are you setting those up to really spread that to smaller hospitals that are within the
Mm-hmm.
network, or even sharing knowledge at conferences like this so that you're really able to touch more pediatric and neonatal patients? That way, not just the daily patient care aspects of it. And so I think in that sense, that has probably been one of the biggest changes is going from my patient this day to how to make things better and safer and more well informed going forward. So,
That's fabulous. And your work with parents and families, how direct is that for you right now? How do you reach those families?
yeah, honestly, immunizations is one of those. So that's why a topic is very near to my heart, and the providers and nurses that I work with know that know that I do feel very much. And so I think that's one of the first areas when I started this position is that they're like, wow, you actually know quite a bit about this. This family has concerns, or they want to know what
Right.
other ingredients are in this vaccination. And so even before I was doing discharge medication counseling, that was one of the areas I was really talking to these family members is
Fabulous.
trying to address any questions or concerns and where the literature necessarily is to support and what are the benefits and what are the risks as well. So,
Right.
I would kind of be the person that would come in to answer, any further questions or, concerns and really kind of help be that additional partner with our providers and nurses to answer questions and really, get the story straight sometimes.
I just love that because I think communication to our families is really key. And you've probably seen over the years too how families have become more and more engaged within that
Hmm.
time period. It used to be quite almost exclusive, but we're seeing a lot of collaborative care, wanting to support families as they transition out into the community. Have those things sort of transpired in front of you as well, Jennifer?
Oh yes, and I think we have been very much about patient center rounds,
Love it.
and where we really much involve parents in the
Yeah.
discussion for that. But I think parents really do they know their babies as well. So I
Yeah.
really truly think of we talk about providers and nurses and even other healthcare professionals such as myself, but parents are a part of that team as well,
Yeah.
and they know the day to day. We might switch on and off and
Hmm.
be in and out, but they're for the most part really are partners necessarily. And that's even when it comes to this presentation of immunizations.
Hmm.
We have a thing, we give a course, for example, in the U.S. our vaccination information sheets, so the VIS forms. But
Right.
even beyond that, we don't. It's not. We talk about getting assent, talking to parents about before immunizations about what it's for, what it was common, what are some risks necessarily to think about, and really kind of partnering with them about it
Nice.
necessarily, but without necessarily just doing something without talking to them. So.
Yeah, I love that because it can be such a minefield of things and information overload. And I certainly appreciate the way that you teach here. So I can imagine how you're teaching the families as well is just fantastic. And like you said, you're so passionate about this area as well. Well, thank you so much. Again, Jennifer Barnes is going to be
Thank
with us.
you.
Don't miss your shot to learn about immunizations in the NICU. This is going to be such valuable information, I think, because immediately this will be able to be translatable and put into practice, communicating with our families and, of course, our colleagues around the world. So thank you again for joining us here today. It's been great catching up with you.
Thank you so much, Fiona. It's wonderful to see you.
And don't
and
forget,
everyone out there too.
yeah, that's right. And everyone listening in, I just love it. Well, don't forget, you can come in to our live event at goldneonatal.com. Jennifer is going to be here along with many other professionals from around the world. We open up the conference on May 30th. So don't miss out on that opportunity. Our keynote is going to be open access and free, so you can all come in and engage in that manner as well. If you're unable to attend the live schedule, all the details are online, but if you can't come and you want to come in and listen to the recordings, they'll be available to you almost immediately after the live event. So stay tuned for all of that information. We can't wait really to connect with all of you listening in today. I know that that's what Jennifer loves to do as well. It's all about community and connection here too. So we'll look forward to seeing many of you online. Talk to you all soon. Bye-bye for now, everyone.